let's jump into some segments. And I got a super crazy story out of, where's this from, Sarah?
Florida.
Absolutely. Another crazy one out of Florida. This one is...
The OBGYN one.
Yeah, this one's pretty nuts. So this is a very crazy and sad story out of Florida, and it revolves around an OBGYN, so an obstetric and gynecologist, that just lost his medical license because he had a patient die when he was doing a Brazilian butt lift. What? Why was an OBGYN doing a Brazilian butt lift? That's the whole point of this crazy segment.
So did he have a plastic surgery business, or was he just like...
He had a cosmetic
here's a
surgery
C-section
business.
And also a butt lift.
Yeah, he was running a med spa that does surgery, which is just kind of bizarre. So this actually happened in 2021. Patient's name was Dr. Christopher Walker, who is an OBGYN. I think he did a year of family practice residency and then an OBGYN residency. And in his med spa, he was performing a Brazilian butt lift. So for those who don't know...
And it wasn't in a hospital.
Correct, yep. Because why, Sarah? Because you're so smart.
He doesn't have his certified whatever plastic surgery thing.
Yes, right, because he can't get privileges.
Board certified.
Yep, absolutely right. So he can't get privileges in a legit facility, so he's doing it out of his office. So he's doing a Brazilian butt lift. For those who don't know, Brazilian butt lift is where you harvest fat from various areas.
And it's the worst.
They're bad.
Right?
I don't like them. I'm against Brazilian butt lift.
Gross. Ew.
I will not do one because they're so dangerous. So he was harvesting. So you harvest
people.
And people die, man. I'm not kidding. Like, people die from these. So with the Brazilian butt lifts, you harvest fat and then you inject it into the buttocks area. And I've talked about Brazilian butt lifts. I do not like these surgeries. I will not perform them. There is a extremely high mortality rate compared to other surgeries and other problems that can happen. So this doctor is doing this Brazilian butt lift. He thought everything was good. He's just marching along. And suddenly the nurse anesthetist says, hey, doctor, the patient doesn't have a pulse anymore, which is obviously a very bad thing. It means that you've gone into cardiac arrest. So he starts... bad. So he starts CPR. They transfer the patient to the hospital. Patient gets taken to emergency surgery. Patient gets opened up, and they discover that during the liposuction, which we've talked about that, liposuction is where you use a hollow rod to suck out fat, the doctor perforated through the abdominal muscles and stabbed the liver, stomach, small and large intestines, and the pancreas, which I'm going to explain why that is just so insane. And unfortunately, due to the numerous injuries that the patient received, almost like they were stabbed with a sword or shot, the patient bled to death. They could not save the patient, which is very sad. So I mentioned the pancreas.
Crazy.
Yes.
That girl must have not had very much fat on her abdominal area. Maybe.
Maybe not. I don't know. I want to kind of explain why this is just so egregiously bad and because it
sounds like no technique.
Very bad technique. So I've done tons and tons of liposuction over the years. Every once in a blue, so I do it a lot with tummy tucks, right? So I do a liposuction with tummy tuck. I'm sucking out the fat, and then I open things up because I want to take off the skin, and so I can kind of see how good of a job I did. And every once in a blue moon, I will occasionally just kind of skim that muscle layer. Like I've never, knock on wood, perforated it, but I can see where the lipo cannula just kind of skimmed across it. And it actually, you have to really kind of get out of sorts if you know what you're doing to perforate that muscle layer because it's pretty thick and it's pretty hard. So this guy, and I have a picture, Trey, can you throw up that next image? And okay, so this is a CT of the abdomen. So this is a cross section through the abdomen. That big white oval is the spine. And then you can see the ribs along the edges. Those are the white kind of dots of the rib cage. So the white arrow at the very top is the fat layer. Now, this patient doesn't really need liposuction because they're very fit. This is not the patient in question. I'm just using this as an example. So the white arrow is pointing to the fat layer. It's kind of that grayish area. It's not the kind of whiter area below or the dark area above. That's the fat layer. The orange X at the top is the muscle layer. That's the one you don't want to go through. The red X is the pancreas.
So that dude straight up stabbed
Dude,
her.
how in the world did he get that cannula at the pancreas? It's like right in the middle of your abdominal cavity. It's just mind-boggling.
Straight up.
That he could even get it down there.
Maybe the person that he was doing liposuction on was so not fit at all. Maybe he didn't feel it.
Yeah, so that's a great comment, Sarah. When you're doing liposuction, one way that you know you're going in the right direction is you have one hand on the cannula, and you have your other hand either holding the fat up and you're feeling the rod kind of go between your fingers, or at the very least you're using your fingers to feel the tip of the rod. So that's one of the tricks. So obviously don't try this at home because you can obviously hurt people. But that's the way that I know I'm in the right position. I'm basically I'm using the rod with one hand, but I'm guiding or feeling the rod with the other. So I know that I'm not going too deep and I'm not going to injure someone, because obviously going through that muscle layer can result in death. So how did this happen? How did this doctor egregiously screw this up? Well, it's because he doesn't have proper training.
Right. Yeah.
You know, I will at least say that an OBGYN has some surgical training, because GYN, my wife's an OBGYN. She did surgery.
Yeah.
Of course, it's very specialized surgery. Things like hysterectomies and tubal ligations and, mostly.
Not BBLs.
Correct, not Brazilian butt lifts. This guy had
Delivering babies and
This
such.
guy had no plastic surgery training. Now, I did a super deep dive on this one because I want to bring you guys the absolute best information. I actually downloaded the PDF from the Florida Medical Board that talked in a lot of detail about this, and it was kind of mind-numbing to read it because it's all in legal speak. But it did talk about the training that this doctor received to make him feel like he could even do this.
Shadow somebody.
Yes. So in 2017, this doctor attended a 2-day course in Massachusetts on tummy tucks, where liposuction was being performed. However, he was just watching. He couldn't actually do it, obviously, because he didn't have a license in Massachusetts and he wasn't trained, so he just watched. In 2008, he attended a 3-day course in Florida where he was allowed to put his hand on the hand of a surgeon doing liposuction, like almost as if, when you're trying to teach a child like how to swing a golf club and well, I guess that would be the opposite, but you get my drift. He wasn't actually doing it. He was putting his hand on a surgeon that was doing it to kind of feel. So this guy did a 2-day course and a 3-day course where he didn't actually do anything, and thus felt he was capable to perform these procedures that I did 8 years of on-hands training to be able to do. And the saddest part is after this basically zero experience, that still was enough to get him board certified by the American Academy of Cosmetic Surgery. Remember when we talk about fake boards? How big of a joke is the American Academy of Cosmetic Surgery that they will certify somebody who's had 5 days of training in plastic surgery? An absolute just joke. It's a travesty. That's why I always talk about board certifications, and they're only being...
That's so scary.
It is, because that person obviously will put on their website, board certified by American Cosmetic Surgery. Yeah, absolutely, just almost...
I could see that's a good business idea for
of course.
an OBGYN to be in charge of a med spa, but to be in charge of it and then have maybe plastic surgeons working for him if he was just the business owner of it.
Yeah, and that brings up a great question, because that is...
If that's what he wanted to do with his business, that's what he should have done instead of just
I don't want to say beef, but my counterpoint to that, and I think it's, a great... you make a good point that this guy could run the business and then actually hire the proper people.
Not do the surgery.
So, as you may or may not know, every med spa in the United States has to have a medical director, okay, who technically should be in charge of all the procedures that are being done. Now, in this case, doing surgery in a med spa is really weird. That's not a common thing. Yeah. But just take your regular med spa that has, lasers or anything like that. The medical director really should be the one that's kind of in charge and the kind of the end-all be-all of knowing about these things. Well, most med spas are actually run not by a doctor, they're run by someone else, but their medical director, they have to have a medical director, so they'll hire maybe a family practice doc to be the medical director, so they're legit, and then someone else actually runs it. And so, I have a little bit of beef with that, and the med spa I run, I'm the medical director, and I know about these procedures in a lot of detail because aesthetics and plastic surgery are commingle, right?
Yes.
Dermatology be another decent medical director because they're very knowledgeable about skin and those type of things as well. But when you get a med spa that's run by someone who doesn't have that knowledge, there is some gaps there.
Yeah.
It's like the remember the story of the med spa where they were doing IV therapy and they got the wrong IV bags and the patient died.
Yeah, I remember that one.
Their medical director was like an anesthesiologist. Well, what does an anesthesiologist know about? I guess they would know about IV fluids, but I mean, just aesthetics in general.
Yeah.
You know, they're not going to know a whole lot. So, anyway, back on track with Dr. Christopher Walker, who this past week the Florida Medical Board basically crucified him. There was a board-certified plastic surgeon on the medical board and just tore this guy apart, saying that, you know, he had no training whatsoever to perform these procedures, which absolutely can be very, very dangerous. He didn't even know that he'd done this. You know, he thought the patient was doing fine, and then suddenly they were in cardiac arrest. So they did.
At least he didn't pretend like it didn't happen.
Right. At least he did call
Like that
911.
other one?
Okay. Yes, we will give him. We will. Yes.
That other doctor was just like, we'll just wait a bit.
Yeah,
See
let's
if
go
she'll
see
wake
some
up.
consults. Yeah. So I guess we can give him a consolation prize if he did at least do the right thing and call
Yeah.
911, and there was an attempt to
save
the
her.
patient. Correct, which is good. Unfortunately, it didn't work just due to the massive injuries that the patient received. But yeah, I think that, you know, obviously when we talk about these things, we're not doing it for sensationalism. I mean, it's really to educate people. Prevention, right, because the average consumer gets really confused about who's trained to do what. And the bottom line is if you're going to have plastic surgery, you should go to a plastic surgeon. There's an enormous amount of training that goes into it. As I said, I did eight years of surgical training, board certification, which requires massive amounts of just testing and certification that you know what you're doing. This guy was doing the same things that I do, and he went to 5 days worth of courses where he didn't actually do anything.
Yeah.
And that is very scary. And that's not just Florida. I mean, there are people in this Dallas Metroplex, probably within 5 miles of this chair I'm sitting in, that are doing the same thing. I once found a internal medicine doctor that was doing Brazilian butt lifts here in Dallas, Texas, in his office under local.
Gross.
Yeah, absolutely insane.
So if somebody's watching this, they should comment what doctor they're thinking about seeing, and then we can investigate them.
Investigate him.
Put them on blast.
You know, I've actually thought about that. I've actually had that exact idea where, you know, I set up a website and someone can drop in a doctor's name, and then we kind of review them and make sure they're legit.
That'd be fun.
You want to start a business together?
I mean,
Trey, Yen, the
this.
three of us?
For a
let's do
segment,
it.
that would be fun. I don't know if I would be able to do that like all the time.
I could teach you how to do it. I mean, what if you could do it if you're making money at it?
And then we could go undercover.
Oh my gosh.
I can go into the office.
You can go
Travis,
undercover.
help us. Yeah, you're the spy. We were just
I'm
talking
here
about you were a
for
spy earlier.
BBL consult.
Oh my gosh. But scary stuff. Once again, you know, if you're going to have plastic surgery, go to a board certified plastic surgeon, not a cosmetic surgeon. That's not a real thing. Cosmetic surgeons are not real. They're
Oh my
made
gosh,
up.
you could go in for elf ears.
Dude, I kind of like elf ears. We haven't talked about the elf ears in at least 6 months.
And
been
it's
a
so
while.
appropriate right now because it's Christmas.
Yeah, I don't want to be like a Christmas elf. I want to be like a Lord of the
Rings elf.
Lord of the Rings elf. All right, I think that's about all the time we have for this episode. Thank you guys so much for tuning in. We really do appreciate it. Please leave us a comment if you want us to talk about any topics. We would love to hear from you, and we'll see you on the next episode of Nip Talk.
Bye.
Bye.